The digestive system. The digestive system includes surgical procedures involving the lips, mouth, and tongue, palate and uvula, salivary glands and ducts, pharynx, adenoids and tonsils, esophagus, stomach, intestines, appendix, rectum, biliary tract, abdomen, peritoneum, and omentum. Codes are categorized by body part and then by procedures such as an hemorrhoidectomy and ileostomy. In general, gastrointestinal endoscopies are categorized by body part involved, type or purpose of endoscopy, and specific procedure that is performed. The endoscopy should always be coded as far as the scope was passed. The EGD in upper gastrointestinal endoscopy involves the visual examination of the esophagus, stomach, and upper duodenum and or jejunum. Some indications for this procedure may be inflammation, ulceration, and bleeding, abdominal pain, to name a few. In CPT, the diagnostic procedure is listed first, followed by a list of descriptions for surgical treatment. According to CPT endoscopy guidelines, it is appropriate to list multiple codes if the documentation supports the coding selection. For example, during an EGD, the surgeon performs a snare removal of a polyp and a removal of a foreign body. These code assignments may be listed, and for physician services, a modifier 51 may be appended to the second code to indicate that multiple procedures were performed by the same physician at the same session. The code ranges can be located in the index under Endoscopy, Gastrointestinal, Upper. There is no alpha index for the abbreviation EGD. And remember always to read the op note to determine what was performed during the scope. ERCP. It's a procedure that is used to diagnose conditions in the liver, gallbladder, bile ducts, and pancreas. The liver is a large organ that makes liquid bile that helps with digestion. The gallbladder is a small pear-shaped organ that stores bile until it's needed for digestion. The bile ducts are tubes that carry the bile from the liver to the gallbladder and small intestine. These ducts are sometimes called the biliary tree. The pancreas is a large gland that produces chemicals that help with digestion and hormones such as insulin. An ERCP combines the use of X-ray and an endoscope. Through the endoscope, the physician can see the inside of the stomach and duodenum and inject dyes into the ducts, into the biliary tree and pancreas so they can be seen on X-rays. Lower GI endoscopies can be classified by the area of the intestine examined as follows. A proctosigmoidoscopy exam is for the rectum and sigmoid colons. A sigmoidoscopy is the examination of rectum and sigmoid colon that may also include a portion of the descending colon. And a colonoscopy is an examination of the entire colon from the rectum to the cecum that may include the terminal ileum. Indications for performing lower GI procedures include an abnormal barium enema, a lower GI bleeding, iron deficiency anemia of unknown etiology, and diarrhea. When coding a colonoscopy, the coder must review the op note to determine the approach through an existing colostomy or the rectum. It is important to differentiate between codes 45383 and 45385, which are in regards to the ablation or a snare for removal. The questions that one should be answered before a code is assigned for an endoscopy is, was the diagnostic endoscopy performed as part of the surgical endoscopy? And if so, only the surgical endoscopy should be coded. And what was the purpose of the endoscopy? And what approach was used to insert the endoscope? In coding incomplete colonoscopies for physician services, there may be a case of a colonoscopy that the procedure may be attempted, but circumstances may prevent the entire colon from being visualized. For instance, poor preparation. In this case, CPT guidelines instruct the coding professional to assign the colonoscopy code with the modifier 53 for discontinued procedures. This is for physician services. This note is located in the CPT guidelines. Also, Medicare covers colorectal cancer screening tests for early detection of colorectal cancer when coverage conditions are met. Among the screening procedures covered are screening colonoscopies are colonoscopy on an individual with high risk and a colonoscopy for individuals not meeting criteria for high risk. These are G codes, G0105 and G0121, and are found in your HCPCS code. These codes are to be assigned instead of the CPT code 45378, diagnostic colonoscopy, when there is no need for a therapeutic procedure. Treatment of hemorrhoids. Well, there's a variety of CPT codes dedicated to the treatment of hemorrhoids. Hemorrhoids are swollen and inflamed veins in the anus and rectum. It is important to note that several codes in this section are not numerical order and are out of sequence. It's important to determine the technique for the treatment, whether it be via incision or destruction. With regards to incision, an incision is made over the thrombus, and the clot and the diseased hemorrhoid plexus are removed in one piece. With regards to destruction, for example, destruction of an internal hemorrhoid by thermal energy, this procedure may include cautery, radiofrequency, and infrared coagulation. Infrared coagulation involves a small probe with a light source that coagulates the veins above the hemorrhoid, causing it to shrink and recede. Hernia repairs. An abdominal hernia occurs when internal organs such as the intestines break through a hole or tear into the musculature of the abdominal wall. This protrusion produces a bulge that can be seen or felt. Symptoms may include burning and pain with activity. A coder must abstract documentation from the health record to support the coding. One will check for the type, of course, and in this case, for example, inguinal hernia, which is a common herniation of the inguinal canal in the groin area, or, for example, an incisional hernia, which is a herniation at the site of a previous surgical incision. Then the diagnosis: is it incarcerated? That is, the hernia cannot be reduced without surgical intervention, or is it strangulated? The hernia is incarcerated hernia, which the blood supply to the contained organ is reduced. A strangulated hernia presents a medical emergency. Then you would look for whether or not it was a recurrent or initial, and possibly the age group. Some codes provide historical information specifying whether the hernia is an initial repair, which is the first surgical repair of the hernia, or a recurrent repair, where the hernia has been surgically repaired previously, while other codes differentiate patients by age, such as any age younger than 6 months, or 6 months to younger than 5 years, or 5 years and older. And laparoscopic repairs are codes 49650 through 49659. Here you note the laparoscopic ventral hernia repair. You note the preoperative condition of the abdomen, and where their small intestine is adhered to the abdominal wall and is protruding into the previous incision site. Then you see the scope approach and how it is inserted into the abdomen. And then finally, the Gore-Tex mesh is sutured into the anterior abdominal wall. The use of the mesh code 49568 can be used as an add-on code only if used for an incisional hernia and a ventral hernia repair.